Okay. Well, I'm going to intro. Good morning, everyone. My name is Noah James III. I am the Educational Liaison and Client Manager of the CARE program here at Sickle Cell Anemia Awareness of San Francisco. We also have my brother and friend, Mr. Antoine Kapla, and the founder of the organization, Nadina Brox, on the call. I would like to also say thank you to Mr. Lamar Jones, our speaker today, and welcome him to the advocacy and empowerment session. We are enthusiastic about our presenter, and we are going to be focusing on championing mental health, equity, and uplifting communities of color. Before we get started, we're going to just do a short exercise to breathe and ground ourselves in the space. So if you're not already, please sit in a comfortable chair or where you are at the edge of the bed. Have your feet planted on the ground. Bring your eyes to a low gaze and just take a few deep breaths with me. I'm going to breathe in for 5 and then breathe out for 8. One more time, breathe in for 5 and out for 8. Last time for good measure, breathe in for 5, breathe in positivity, joy, and exhale for 8. Let go of the negativity, the stress, everything from the week before. Thank you. Thank you, thank you, thank you, thank you. Now that we are together at this point, I want to have some announcements to share. Yeah. Okay. So in the chat, we have forms here, Google form to evaluate this session. We would love it if you can just fill out this form. The importance of this is to get data to maintain the program along with your continued support. So please just have this on the side, and as you go through the presentation, at the conclusion of it, remember to fill it out. We will make sure we have time and space so that we can fill it out together on the call, and that'll help us out a great deal. I would also like to remind you that next month, September, we have our KMJ Health Expo, which I am super, super excited about, and I hope I'm seeing all of you there. The KMJ Expo will be September 13th from 10 to 4 at the Bayview Opera House in San Francisco. So please come, please block out that time in your calendar. We would love to see you there. I will drop the link to that event in the chat as well so that you could get your tickets. I'm a little early, but Antoine, would you like to say a little bit more about the Health Expo or about your favorite parts of the Health Expo historically?
I mean, for the most part, it's just an opportunity for us to try to gather as many of the community, whether they be sickle cell clients, whether they be folks with the sickle cell trait, whether they be advocates, caregivers, family members, and just the general public, so that we can give everybody an opportunity for community, but then also make sure that the clients that go through these things and get to points in their lifespan where they feel like they may be alone, to just advise them and let them know that they're not alone. That's really how we want this to try to be. There was a lot of times my brother felt that way, even though we understood that there was more people in the world that were dealing with this situation. But, when you're caught in your own little bubble, that just happens to really push your mind into a space of solidarity. And it's really important for us to try to keep that flow of community in these people's perspectives so that they know that there's somebody that's going to support them if they do feel alone, or they know that there's somebody dealing with the same thing so that they understand that they're not alone. So that's really what I feel like is the best part about our expo. And then obviously making sure that people have the opportunity to meet and greet those that are going to provide necessary resources for them to have an opportunity for sustainability or just increase and enhance their lifestyles. But yeah.
Hmm. Of course, there will be food, entertainment, other
Mhm.
health booths out there. So, good. I'm excited to see all of you there if you can make it. And thank you, Antoine. So, I'm going to introduce today's presenter, Mr. Lamar Jones, for championing mental health equity and uplifting communities of color. I'm going to read his bio, and then we're going to get started with the presentation. Lamar Jones currently serves as a clinical therapist with Blended Roots Therapy through the Cayenne Wellness Center program, where he provides culturally responsive mental health services to people of color, particularly men of color and individuals living with sickle cell disease. Over the past year and a half, Lamar has supported this community with compassion and purpose, describing the experience as both an honor and a deepening of his life's calling. Lamar is a dedicated social worker with a strong commitment to addressing systematic inequities in low-income and marginalized communities, approaching these issues through a lens of cultural humility and equity. A two-time graduate of the California State University system, he earned his BA in sociology from California Polytech State University, Panoma, and his master's of social work from California State University, Northridge, where he specialized in urban populations. In his current role as a program specialist and data analyst for the Emoja program at Fullerton College, Lamar provides vital resources and holistic support to over 300 students, empowering them to achieve academic and personal growth. His work goes beyond the classroom, and he is a consistent force in community advocacy and student-centered activism. Lamar's community involvement includes organizing and participating in protests for student rights, immigrant justice, the Black Lives Matter movement, and the Stop Asian Hate movement. He served meals and hope on Skid Row, working with the LA County Department of Education, and represented students on the admissions committee at Cal State Northridge. His efforts to close equity gaps are highlighted when he presented at the EOP and S 53rd Annual Conference and hosted Fullerton College's first Black graduation ceremony spring of 2024. As a former foster youth and advocate of that community, Lamar has remained deeply involved in mentoring, currently guiding students through the Mentor Match program at Fullerton College, and he also shared his journey and insights on panels at Cal Poly Panoma and the Ontario Montclair School District. Whether through therapy, education, or grassroots advocacy, Lamar Jones is a powerful voice for social justice, a mentor to the next generation, and a tireless advocate for equity, particularly for those overlooked and often those individuals like myself living with sickle cell disease. Lamar Jones, welcome to the A&P session today. How are you?
I'm doing good. Thank you, Noah, for the introduction. Thank you to my friends and then some of my family members that'll be jumping on. I see you, Anna, Jose, Autumn, Valerie. Thank you, guys. Yes, I'm excited for today. As Noah mentioned, I just kind of wanted to talk about mental health with sickle cell warriors. He'll kind of go a little bit more in detail about what sickle cell is, because I know some people may not know, and that was something me and him wanted to make sure we have a good foundation before we do those building blocks. But thank you, Noah.
No problem. I am ready when you are. I wanted to say I do live with sickle cell disease, and so this topic for me is close to my heart because I recognize the significance for individuals living with pain on a regular basis, how crucial it is to have support, to be able to talk about your feelings, your experiences, your struggles. And I have experienced very robust racism and oppression in the hospital setting, and oftentimes alone. And so making sure we have therapists and counselors and just our care team there to walk us through that is so crucial. And so I'm really happy that Lamar is here for this presentation. And for those of you that don't know what sickle cell is a blood disorder. It is genetic. It is something that you get from your parents. And what it does is it makes it a little bit complicated for that blood to flow in your body. And when those complications come, it causes pain wherever. It could be in your upper extremities and your lower extremities, in your bones and your muscles. Everywhere there is function, it can be pain there. And so we're going to dive a little bit more about how this goes into the struggles we face mentally and how it makes it hard sometimes. Hold on. Did you want to play the video?
No, I think you did a good job. And then, yeah, you kind of explained what sickle cell is, and then I touch on it in there. Not everything, but where it pertains to mental health. And then I'm going to elaborate like some of the clients that I serve and some of the stories y'all have shared, you and other, sickle cell warriors. So thank you.
Cool beans. All right. Please enjoy the presentation. And here's the floor, Lamar.
Okay, thank you, Noah. Well, once again, welcome everybody. So, as you know, I'm Lamar Jones, and today I wanted to talk about the intersection of mental health and sickle cell warriors. And what that means is that when you think about an intersection, somewhere they meet, and then there would also be overlap. And as I've been getting on into this journey, and really trying to be of service to the community and bring this now to you in community, I think this was the topic that kind of explains everything well. So I'm gonna go ahead and get started. So with that, some of the overview that we will have is, so some of the overview learning objectives, we will define the mental health needs commonly seen in people living with sickle cell. We will review the prevalence data and impacts on clinical outcomes, describe how discrimination and medical mistrust affects the care that is given, explain the role of culturally concordant therapists, like what does it mean to have a Black therapist for Black men and men of color, and then offer practical strategies and resources for providers, families, and warriors. And the thing I wanted to share is this is not just simple information you get off of Google, because I know that we get into a world where we're collecting information, but we don't have knowledge. So everything here is scholarly articles. So that means that this actually had to go through a process of this data being collected and researched, and they have to live by ethical principles and guidelines so that this data can get on here. So anything that you see today is actual data, is not made up, and things like that. And thank you to everybody that just joined on. We already have started the presentation. So why does mental health matters for sickle cell warriors? Mental health matters because it is the heartbeat of how we live, connect, and thrive. It guides the way we handle challenges, build relationships, and make everyday choices. When our mental health is strong, we're not just surviving, we are growing, creating, and contributing to the world around us. Prioritizing it is not optional. It is the foundation for a fuller, healthier life and community. So some of the ways that mental health have this connection, this intersection, is physical health connection. Mind and body are deeply linked. Sometimes we think if I just go to the gym, if I just got a good job and everything looks external, everything's okay. But let me tell you that even before I got connected to this community, when I used to do therapy for other clients, people are thriving materialistically wise. They're making 100,000, 200K, but yet mentally they're going to crap. And whatever is going on the inside is naturally going to pour out into the external, into the outside. So we have to make sure that our physical health and our mental health is also connected. Stronger relationships. Mental health shapes how we connect with others. When you feel mentally okay, when you're not overthinking everything, when you're walking in a mindset and a heart posture of being open and willing to connection, that love is always on your side, that you can trust yourself to trust the right people to connect with, that naturally leads to you having stronger relationships, whether that be friends, whether that be romantic relationships, whether that be with colleagues and peers, or something like this where you may only be connected through one person, and you're getting this information today. It produces productivity, supports success at work, school, and daily life. When you are not in a mental fog or when there's not clutter in your mind, you're able to think better. You're able to make better informed decisions. You're able to take other opinions and feedback, and you're aware of your triggers and your traumas because we all at some point have some baggage that we're bringing from our childhood to every situation that we have. So I believe once you do your mental health work, that helps you be more productive in anything that you do. It builds resilience, helps us bounce back from challenges. We all, from time to time, will feel depressed at one point, have anxiety, panic, worry. These are all things that are important of mental health. And we have to make sure we take care of that because life is always going to have challenges and barriers. There's no way around that. So, in order to make sure that you're able to bounce back, get back into the game, and make sure that not only do you get back into it, but you come back stronger and wiser, that is about making sure you take care of your mental health. And then lastly, a positive self-image. Working with this community, as Noah kind of shared, they go in and out the hospital because there is problems with the blood cells that is going on in their bloodstreams. So I mean, like I literally could be talking to a client on Tuesday, and next Tuesday they've been in the hospital for the week. And then I leave, we speak, and then come back again on Tuesday or Friday when I speak to them, and they're in the hospital again. And that can really damage your self-worth and your self-value, how you view yourself. So it's very important that we make sure that they get the mental health services, but that we all do so we see ourselves in the light. Because when we see ourselves in a positive image and a positive likeliness, then we're able to give that out. You only can give what you got. So if you feel good and positive about who you are and your self-image, you're only going to give that to others. Why mental health matters for sickle cell warriors, part two. So, sickle cell warriors face chronic pain, fatigue, and unpredictable hospitalization, which can lead to heightened vulnerability to depression and anxiety. An example, a 2021 systemic review found that up to 35% of adults living with sickle cell disease reported clinically significant depressive symptoms. Untreated mental health conditions can often precipitate more pain crises, longer hospital stays, and increase healthcare costs. A prospective cohort found depressed sickle cell warriors patients had 2 times the number of ED visits compared to peers without depression. As you know, when you are mentally going to things like, say if you go to work and say you before you got into work you had so much on your mind, and then when people are trying to engage with you, you're just not at your best and you're trying to get through the day, you're not doing your best work. You might even stare at the screen for a few hours or a few minutes while nobody's looking because you just can't focus. Now imagine that with having an actual medical condition that is literally attacking your body, causing you pain. I even had some clients who hips were breaking on them because they're not getting enough red blood cells and oxygen, because the red blood cells bring oxygen. So imagine that going through something mental and something physical. So it would make anybody not being able to participate in any medical treatment or any medical thing solutions that's going to help them because mentally you're not there. So I just want us to really be mindful of that as we're reading this, not only are our sickle cell warriors going through something mentally, but they're also going through a lot of things physically, which can be very excruciating for them. So, more statistics regarding sickle cell. The reason why I'm throwing out statistics because we can get into facts and beliefs and opinions, but the thing that will always stick is facts. So that's why I'm going to, and then I'm going to get into some more things later. But this is why I really wanted to put statistics, because I wanted to make sure that we're having this. So the first statistic: sickle cell warriors are 2 to 4 times more likely to experience depression and anxiety than the general public. Nationwide, depression affects about 8% of adults and anxiety about 19%. For warriors, those numbers often climb to 20 to 40%. That is an actual statistics. And the reason why this is important, we all to some extent have experienced depression, anxiety, panic, and worry. And as you know, that can really shut your body down. Depression can be like mood swings, not able to get out of bed, not able or not feeling or not up to eating, and you know you need to eat because your body needs the nutrients for what you put into your body. And then for anxiety, it can really make it hard for you to focus. I've had clients in person that I used to get therapy for, and they literally will be shaking and can't really focus, and their mouth is kind of twitching because it's hard for them to get out the word. So anxiety can then lead to paranoia that somebody's out to get me, and then that can create fear that, oh, I can't trust people. And then once our sickle cell warriors start to get into that mindset, or anybody in general, you then don't want the resources that provide to you because you're now paranoid and skeptical. Can you really trust this person? Because when you're talking about mental health and when you're meeting with a therapist, you have to be vulnerable and open. And you can't do that if you don't feel safe within yourself first, within your mind, within your spirit, but then also within the space, whether that's in person, on Zoom, or over the phone, because those are some of the modalities that I provide to my clients. The second statistics, about 1 in 3 warriors live with depression or anxiety compared to less than 1 in adults nationwide. These mental health challenges aren't just numbers. They shape pain, they shape pain, they shape pain experiences, treatment adherence, and family life. So when you're thinking about when Noah kind of shared and what I'm sharing today, when you're thinking about mental health and when you're thinking about sickle cell, you also have to think that some people are, this is from birth, this is passed on from your parents, this is genetic. So then this is something that as a child, so example that I have a new client, and one of my clients, I asked them what was something that you want to work on therapy, and they said abandonment issues. And I'm used to hearing abandonment issues like you're with your parents, but they never gave you enough attention, and then that can cause emotional abandonment and physical abandonment. Maybe you were in foster care, so you never seen your parent. But I didn't get this story till this week, and the client shared, well, because my mom was a single mom and my dad was on drugs, my mom would literally have to leave me at the hospital for 8 years, I mean, for 8 hours upon days at the ages between 6 and like 15. Can you imagine being in a hospital by yourself as a child, as you're still trying to navigate what's going on with your body and trying to, and thinking of all these clinical terms that people are talking about you, and the only thing that you really want is your mom and dad there, and nobody's there. He said sometime his grandma will be able to come in, but because she was much older, she couldn't do that. So I just want us to really think about that, how that shaped the experience. And then he talked about how that caused his mom to be more frustrated. She was more angry. She had to work 2, 3 jobs because she had to not only be able to provide some of the medicine and things, even though he had Medi-Cal for that, but then he had 3 other siblings, and then he had a brother with a heart condition. So mom was frustrated. She couldn't go for her goals and dreams. And this client actually migrated from West Africa. So they actually had a good life. They actually had a house they homed and everything. So then there was this shame and guilt as he grew up, that he felt that he took a life away from his mom. So then not only are you physically dealing with something, going back to the mental part, you're also trying to process these things as a child when all you should be doing is worrying about getting the health and the care that you need, but you can't even focus on that because you're also working through the shame and the guilt that your family have to go through this, even though it's not your fault. For number 3, it is not just the warriors. Caregivers face high emotional stress, financial strain, and daily disruption that impact the whole family. Caregivers often juggle emotional stress, financial pressure, and disrupted routines, which in turn affects a person with sickle cell. So, yeah, so I already shared an experience, and this is something that I kind of see, and then it makes it where my sickle cell warriors, as my clients, they don't always feel seen and heard. I had another one of my clients say, you know what? My mom used to actually force me to go to school. I wish everybody, the adults around me, understood how painful that was. That I literally could not walk, that I literally was immobilized, but yet I had to go to class every day so I wouldn't fall behind, or because there wasn't enough education on it about it at the time. So I'm really driving this home with the statistics, but also giving you that quantitative, that storytelling, this narrative around what I see in my clients, and then that intersection again, that they don't feel seen and heard. They somewhere in their experience they were emotionally abandoned, because we think of physical abandonment most of the time. Oh, your parents wasn't there. They gave you up for foster care. You live with your grandma. You live with your uncles, your auntie, or your cousins. But we don't talk about the emotional abandonment, where our sickle cell warriors don't really get the space to really emotionally speak about it because their parents don't have the tools. And the medical providers don't know about this because sickle cell predominantly expect Black people or people of color. So because mental health and medical things really is tailored around and cater to non-people of color, white people, most people don't even know about sickle cell. So they don't know how to engage, they don't know how to inform, and they don't know how to give the resources and tools that our clients need. So I'm going to go ahead and move on to the next slide. Thank you to everybody that's just joined. So mental health, pain, and health outcomes. Mood disorders like depression, anxiety make it harder for warriors to cope with pain and stress. Without those coping skills, hospital visits is often double. One of the things that I have to teach to some of my sickle cell warriors and my clients is how to do breathing. Because when we are in stressful environments, when we are in stressful situations, you might not think about it, but later after this presentation and when you're stressing out and you're worried, think about it. You tend to forget how to, like, you forget to slow your breath down. You start breathing faster, you start pacing, you start looking on your phone and your laptop and your tablet, trying to figure out how can I solve this problem that I'm dealing with. So sometimes I have to literally walk through my clients. And I was one of those clients. When I had back pain, I literally understood the importance of deep breathing and stretching. And that is something that I had to teach my clients, that sometimes you have to breathe and slow the mind down so you can think clearly, so you can be engaged as much as possible. And it doesn't mean that they're not still going to go through the physical pain and they're not going to have that barrier, but it does mean that we can kind of minimize that. Second, bulletin point: studies have found that depression is linked with higher readmission rates for warriors, meaning they're more likely to return to the hospital soon after discharge. Something that my clients also share in the intersection, a pattern that I hear, is that this hope. They get these hopes that, oh, I'm gonna go back to school, or I'm gonna work. Some have full on families, married, kids, and I'm gonna go to the park, and simple things that we may take for granted. And they're 1 minute feeling good. Literally the next week they're in the hospital getting a transfusion or something like that. Or they're going through gene therapy where they need a blood exchange and things like that. It is that drastic, that severe. So simple things with that leads them back into the hospital. That takes them away from family time. I remember one of my clients was just so excited when him and his wife was planning a day to take their daughter grocery shopping, because he was so much in and out of the hospital that he couldn't do something as simple as going to the grocery store and picking out groceries with his family. So these are some of the hidden stories, some of the background stories that I'm trying to just bring to light and bring to our attention. And some of the things that has helped while in therapy with that is CBT, so cognitive behavioral therapy, and ACT, acceptance and commitment therapy. So if you don't know what cognitive behavioral therapy is, it is, first we have a feeling and emotion. And then that feeling emotion then creates a thought. That thought then determines the behavior or the action that you have. So say somebody walked by me and I say hello and I didn't like the way they didn't respond. Then I'm start thinking, and my colleague, and I start thinking, oh, you know what? I don't like the way they walk by me. So maybe next time I'm not going to speak to them. So then that dictates how I act and behave. So next time when I see them, I act like I see something else, or I act like I don't acknowledge them at all. That is what CBT is, and that's what I help my clients get through. So then when they're going through the medical system where they feel nobody hears them or see them, they then paint that brush with everyone. So I had a client that I just got, like, we're on our third session, and he was like, yeah, he said, I always overthink and I'm always overly judging. And I was like, where is that stemming from? He was like, well, when I come in the medical center, 9 times out of 10, most people don't believe me anyway. And then I said, so then what happens for that few percent of the people that is there, and they may not be informed, but they're doing their best to make sure they support you? And it kind of stumped him, because he had to sit back and had to really process that, oh wow, like, even though this is something common, I can't, it's not a one size fit all. It's on a case to case basis. So then we had to double down back on that. And I said, then there must have been times where you over analyze and overjudge yourself, because you only can give what you got. So that's why you're giving it to others. And then from there in therapy, as you can see, we start doing our work and start getting deeper into the root. So that is where CBT do, because it helps us reframe and restructure, but also become aware that our feelings, emotions, and our thoughts dictate how we act and show up in the world. With acceptance and commitment therapy, why this is so important sometimes in sessions is because it helps my clients acknowledge that even though I've been in the hospital for 2, 3 weeks straight, or I got out for 2 days and I'm back for a whole nother week, even though I'm here, I'm going to accept that this is my life, and then I'm going to commit to getting better. I'm going to commit that I can still go for my goals and dreams, but I might just have to tailor that to my lifestyle, to my reality. Because it's very important with my sickle cell warriors when their body is physically being attacked because the red blood cells may not be getting through, even because it's sliced in an S shape that even can cause clogging, which can lead to heart attacks, strokes, seizures, and other things. That can be very hard to stay focused on your goals and dreams when your body is physically doing things that you cannot control and you cannot determine how that's going to be. So I do ACT. So even though you're going through this, how are we going to get through this? And
Lamar,
even
can I
though,
ask a question?
yes, please.
I just wanted to ask the idea, the term deeper when we're
Yes,
talking about looking into what's really the root of an issue. I
yes,
sometimes I feel like that gets glossed over
yeah,
in respect to the client and
yeah,
understanding exactly what's the context of deeper or something looking further into something because most of us we go throughout our days thinking surface level anyway because it's a
right,
transaction after transaction in
right.
respect to our conversation. I just wanted to ask if there's any extra context you could put towards why the term is used to look deeper because there's a root of something that's really aching you opposed to what you spat out just a minute ago. Does that make sense? That question?
Kinda. Can you rephrase it for me?
Okay, so like for example, if I'm thinking to myself, I had an interaction at the hospital with
Mhm.
somebody and I'm judging them, right?
Yeah, yes,
And I realize that I'm overjudging them, which leans into other aspects of my life of judging others that from this trauma that I'm experiencing. And then when you're talking to me in the diagnosis, you're saying, okay, let's look at the deeper meaning. You had this altercation with this person that made you feel either inferior or um, it made you feel like as though support wasn't on your side, and you determined that this person you don't want to talk to them anymore, right? So that's a situation that I experienced.
right.
Then you recognize that I use the term I'm over judging everybody. So you said one size fits all opposed to case.
Right.
What I'm asking from you is when a person of your education uses the term looking deeper or there's something that's a root of a cause, where do you feel is there a way that you can describe what that means to somebody?
Um, Usually how I really well, everybody sees it differently.
Sure.
And my jam is I try to simplify things. And the way that I get a client to look into that deeper, I look into that deeper, I then start talking about pathologies. And what pathology means that in epigenetics means that we things can be passed down in DNA, and then things can be passed down from behaviors that you've seen or feelings and emotions that you had. So to go a little bit more in detail, and that is with the
Yes.
pathology, it means everybody has a pattern. So
Got it.
then when I'm speaking with my clients and I'm asking them to give me background and details on why are you interested in therapy? What are some of the goals that you want to attain in therapy? Give me a little bit about your background. I'm really listening to the pathology because then once I can hit onto the pattern, I can then go back to the storyline and then we can start getting to the root of the issue.
There we
Okay,
go.
you overjudge others. So then where are you judging yourself? And then it be like, oh yeah, I am hard on myself. Or oh, I do go into groups and think people are not. Or I do think because I have sickle cell, I'm not going to get the job. So then we start working back there, and then we start getting a little bit deeper. Where does that stem from your childhood? Where have
Yes.
you learned
Okay.
this? Or where was their experience? Oh, I was bullied because I had sickle cell. as my Nigerian, as my client that came from West Africa, that's Nigerian, he had a language barrier and sickle cell. So he was double bullied for that. So then that made it was understandable why he was not so trustworthy of others. So
Got
I
it.
really follow onto that pathology, that pattern. And then for me as a clinician, I'll make my way back because then it's like a move, it's like that show How to Get Away with Murder when they show the person what happened and then they work their way back into the story. That is how I do mine. I focused on a pattern, and that then leads to the behavior, these cycles, the relationship with yourself and others, and then it also then touches into the family dynamic, whether you have family or not, how that still affect you. I even had my clients say, "You know what? I forgave my mom, and we're good." And I had to tell them a hard truth. I said, even though you forgave your mom, you are still dealing with the trauma and the residue of being emotionally abandoned.
Yes. And that's I guess that's what I was trying to get to and understanding because what I was meaning about surface level is we don't recognize our patterns. We just go
Right.
through our days and all of a sudden things pop up and then now we need a little bit more introspective thought. Thank you, sir. I appreciate it.
You're welcome. And everybody, I forgot to mention, just as Antoine did, anybody else, if you want to ask questions, please do. I like that style because I'm one of those people, if I get to the end, I may not remember. So if anything stick out to you, please do. I did see Shayla, you did ask about CBT. So CBT, you can just type in on Google. They have courses about CBT. You can get certified in that. They have YouTube videos on that where you can also look up what is CBT. They explain it more in detail and things like that. So it's not this exclusive thing to therapists. It's actually something that is often available to the public. It's just that if you're not doing this work, you may not be aware that it's actually available. So you can always find this online, because as I was going through my program, something that our supervisor and our professors challenged us on was that you need to go ahead and start developing your style as a therapist. So I do CBT, I do ACT, I do strength-based therapy. I also do solution-focused therapy. So these are all simple terms. I mean, these not simple, these are all general terms that we as therapists, and there's so many other ones that I haven't even tapped into. So yes, you can find those online. You can just type in CBT or cognitive behavioral therapy. They'll have courses that you can take. You don't have to be a mental health professional or therapist if you just want to get more informed, because you can use this in any way. Just as my best friend Charmaine jumped on and shared, she's a CNA. If she wants to get more into that because she can learn how to better service her clients, she can go take a course for CBT and she can get more involved in that. If you want to learn ACT because or strength based therapy because you want people to focus more on their strengths but also being able to acknowledge their weaknesses or their shortcomings, you can also get registered and certified that and use it in your field. So it's used mostly in therapy because we're doing grounded rooted work, but you can really use that across any fields. But thank y'all for these questions, and yes, please, everybody, I love the engagement and interaction. Please stop me at any time if you have any questions. Thank you, Antoine, and thank you, Shayla. So fostering belonging, why it matters. So once again, I focused on a pattern. So I didn't work with now and over like 16 of my clients that are sickle cell warriors. And I kept hearing this pattern, this theme of they were just wanting to connect because some of them couldn't. I have like two clients that couldn't even go to school K through 12. So they had to do everything from home. All they ever known was hospital and home. But then I heard this repetition of belonging, wanting to feel connected, wanting to be a part of something. And we're actually biologically brainwired to need community and connection. You can't go without it. They have done research where some people were put in isolation for a few weeks. And it was already mentally causing increase in depression, anxieties, and things like that. Can you imagine that being your whole life? Where your body physically is not letting you being able to participate in community and connection. And for that, the general thing that I picked from that was belonging, feeling like you are part of something. Feeling like you could belong can make a huge difference. It helps warriors feel it helps warriors feel less isolated. It reduces stigma and encourages them to keep up with their medical care. Equitable mental health care remains out of reach for BIPOC. If you don't know what BIPOC mean, it means Black, Indigenous, Pacific Islander, um, Oriental, and then Caucasian. I think the C, or I think I might got the C wrong. So it just means people of color. And then less than 40% of Black people with mental illness receive services in 2020 compared to over 50% of white individuals. So something that I had to check myself as I was getting into this work of therapy was I was telling my supervisor, and it was something that he had to take me on. I was telling my supervisor, I was like, some of my clients, they just come and they don't really want to do no work. I was like, and what I meant like deep work. And that was a bias that I had at the time. And he was like, Lamar, he was like, I want to share something to you. He said, do you think that all white clients, when they go to therapy, he said, do you think they actually go there and do all this deep work? And I was like, no, I don't think they do. And he said, exactly. He said, therapy has always been accessible to white people just to come and vent, to talk about the issues if they got something going on with their wife. He actually have a client that was just talking about how his daughter and her husband and her two kids moved in and how that's been causing stress and tension. So he said sometimes clients don't even want to come in to therapy to really work on something. They just want to be able to vent. So they let it out so they don't take that out on their family. So he said, we want to offer this as a resource, as a privilege to our Black and our clients of color, that this is something that they never had access to. And it's true when you even think about slavery and things like that, there was no access to that. There was no talk about mental health and therapy and trauma bonding and interracial and generational trauma and the things that we pass on to our future seeds and things like that. So I had to really give myself a reality check that even though my client is showing up and they may not want to talk about what happened when they were 6 years old, the fact that they need to vent and that they can have this safe space to do so, I want to be the one to hold that space. And I had to check my own self. And I had to be honest with myself and my supervisor that that was a blind spot, a bias that I had, that every client that comes into therapy has to be doing deep work when sometimes we just need somebody that understand, that can hear us, that we can vent to. So that was something that I wanted to share while sharing that, because that was somewhere that I had to grow as a clinician. Peer groups and culturally tailored community programs are powerful tools for resilience. They often share understanding, emotional support, and practical coping strategies. So I'm always pushing my clients to go ahead and build community. With the CARE program, they have something called the Pull Up, where they all get together with other sickle cell warriors and things like that. With Cayenne, they have different events and things that we do on Zoom, where they're creating spaces and stuff like that. And I'm always pushing for my clients to build community and connection, because I only can meet with you once a day. And because I work other jobs and I deal with so many students and other people of services, I'm not going to always be able to be available. That's just the reality. I try my best, but the reality is, and then I need time to myself so I can fill up my cup so I have something to pour in yours. So with that being said, it's very important that not only do our clients, but the people that's providing these services are working with these communities. They're also building programs that's building community, which then builds connection, which then makes them feel belong, like they're a part of something. And then once you feel a part of something, like you're working towards something, that increases your hope, your self-belief, your faith in something more that you can do. So I just wanted to also share that as well. And therapists can work with words to build a self-identity that is not defined solely by illness, highlighting strength, passions, and purpose. Some of my sickle cell clients, they built this identity that I am my sickle cell. And even though that is a reality to them, and that is one part of the truth, something that I teach all my clients, and I even tell my siblings, friends, and stuff, multiple truths can exist at the same time. Yes, you are a sickle cell warrior that is going through with sickle cell, but you are also this, and that. You are also somebody that has a testimony. You are also somebody that has goals and dreams. And for some of my clients that are spiritual like me, you are also a child of God, and all these different identities. Because then once we get into sickle cell, it then put them in a totally victim mindset, and it's with reasonable understanding. But I also want them to be a victor as well, where we can shift from just being where I can't do this, but I also want to move to something else. So I want to make sure that I'm always helping them build that identity with something that's going to uplift them. And Vanessa, I see your hand. Thank you, sister, for joining. You can go ahead and unmute and speak. Thank you.
Yes, I just wanted to second on what you said. That was a beautiful thing that a lot of people does not understand is you can quite literally be doing having multiple truths at one. And one of mine is when I go to therapy, I go biweekly, and I had in my mind that okay, if I'm going through this situation, there's no way I can be thriving. And my therapist had to stop me right away and told me, Vanessa, you can quite literally be healing from a situation that you're going through and thriving in other areas. Like, I think in our minds, we feel like, okay, if I'm in a valley season, everything else is in a valley season. And
Right.
I didn't see it as me being a mom of two boys. Okay, Vanessa, in your relationship life, you're going through a valley season, you're healing from something from past trauma and learning to let go. But as a mother, as an individual, you're still thriving in those areas as a
Right.
daughter, as a sister, as a provider in all those areas. So I just wanted to second on that is beautifully said. And I'm glad that you mentioned that because a lot of us feel like it's a one and done situation. Like whatever we're
Right.
in. And that's not the case. That you can very much so be thriving in other areas while going through something else. So I just wanted to second that I love that you put that out there, that there could be multiple truths at once. So
Thank
thank
you.
you for that.
You're
You're
welcome, and
welcome.
thank you for sharing because yeah, it's really true. And yes, y'all, that was my sister. I'm glad my little family in here. But yeah, this is something that me and my sister talk about. So I practice what I preach. I'm not going to tell my clients something that I don't adopt myself or that I wouldn't give anybody else that's close to me. And it is. It's not taken away from the pain. It's not taken away because it really is something that they really do deal with. And when you're in so much physical pain, it's sometimes where my clients can't even think. Sometimes we have to reschedule our sessions because they can't even think about what they want or they're not coherent. Or if I tell them something, they'll be like, I can't even process what you're telling me. So, yes, there is times where they physically have to take that. But then when they do have those moments where they got this energy or where they're feeling better, I try to fit that in there. So when they do face this next time and they get better again, or they just feel they improve from where they was last week, I just want them to hold on to that. So thank you for sharing, Vanessa.
Hey, Lamar, can I ask another question?
Yes,
And this could be something that you may be able to answer later. I was just curious to know because I understand these calls to be um, mm, how do I say, forums for us to talk to each other in real time. But you mentioned a Kale program.
yes.
Is there any point in time that you could elaborate on that and how people could potentially look into that Kale program at some point in time in the call?
Yes, Antoine, can you remind me that towards the end if I don't remember, because I'm also going to get to a research resource slide.
Cool. Yeah, I'll do that. Thank you.
Thank you, Antoine. Okay, so with that, as I was kind of sharing that with sickle cell, this does predominantly affect the Black population, but also people of color. And then with that, as you know, with where we're at with the history in this country and what it was kind of founded on, discrimination and inequality exists in the medical system, especially when we're talking about sickle cell. Many sickle cell warriors face bias in the medical system. This can look like being doubted about their pain levels, labeled as drug seeking, or treated with less urgency. So, an example that I want to share, or a story that I want to share for one of my clients. One of my clients shared to me, which I did not know. And once again, I'm continuing to learn and I let them know, like, I never knew that perspective. And it's just amazing how comfortable they feel sharing this with me. He told me that he has sickle cell at birth and that he has been taking medication since he was 6. If you know anything about your body biologically, your body is always adjusting for survival and stabilization. So, meaning when you, and for example, when you drink, if you drink pretty often, you have a shot, eventually your body builds a resistance. So that shot is not going to be as much as somebody that drinks very once in a blue moon, or somebody that don't drink all and they're just doing it for this one time, a wedding or something, or somebody that might smoke weed because, or marijuana, because after they do a blunt, if they do it all the time, your body build resistance. So now you might need a few more hits or things like that. It's the same thing with any medication. Your body is going to constantly build resistance, build stabilization, because it's just biologically what it needs to do with survival. So then sometimes our clients are requesting for our medical providers that they might need a higher doses, they might need a more frequent gene therapy or blood fusions and things like that. And then they're denied these things. And then I even had a client that shared with me, because they were Black and they didn't really know about sickle cell, they put them on the side of dying people from cancer. It's like, I'm not dying. I'm just needing some treatment so I can get back on my feet, get back to my normal life routine. And then you're going to put me on the side where people dying. That is like symbolic. It's like saying that my life don't matter and that I'm being discarded just like they're being discarded, because you cannot be bothered with the not knowing or not being informed or feeling uncomfortable about something that you're well equipped or informed about, even though you're a medical provider. And I remember I was watching, I remember Cayenne, that's another program that helps with our sickle cell warriors. And they was showing the video. And in the video, the guy said, because he was a professor for other medical practitioners, and in the video, they only spent a week out of years of going to medical school about sickle cell. And that is why nobody in the field of medical, unless it's something that caught your interest, you had an experience, you may be Black and has a relative or a friend that had it. That's why 90% of the people in the field don't even know about it. And I thought that really was interesting, that they learn all about brain cancer and tumors and things like this, because that predominantly affects white people. And there's all this research and funding that goes into it. But then my client, who is coming to you and they're telling you what they need, and they're telling you they've been dealing with this from birth and things like that. And not only do you not give them the medication that they need, you label them as drug addicts or drug abusers, and then you put them on the side where cancer patients are dying. That can make you emotionally feel some type of way. That can cause a tug of war between yourself and how you think others view. That can make you feel less than about your life, because if the medical providers don't think my life matters, why would I think the average person do? Then this is why therapy becomes important, because me and my client had to unpack that, because then I seen this pattern. Because then in the way they were showing up in the sessions, it was always as if, yeah, nobody's really worried about it, da da da. And even though I was showing up, it still wasn't sticking yet. And then I knew this was something that we had to tackle in therapy, and we had to unravel that. And I'm not going to go fully in detail, because of course I got to keep certain things confidential, but the work was getting deeper and deeper. And now that was after the 10th session. And I'm glad to say me and that client were on our 33 session. So this work can really get deep, and it can really be important and you really have to hold space. And it doesn't bother me because I'm Black myself. So discrimination and inequality is there. But I was glad that I was able to accept their truth in fullity, in its fullness, and not judge it, not try to justify it, rationalize why the medical providers did what they did. Oh, they just wasn't informed. So, that they don't need that, because they get everybody that do that anyway to them. Always rationalizing and over trying to justify why they were treated, or why people didn't know how to treat them medically and just professionally. Bulletin point two: when someone experiences this repeatedly, they may start to avoid care until symptoms become severe, which worsens outcome and increases risk. In therapy, I have some clients that say, hey, I tried to give therapy a shot. It wasn't working for me. So I kind of stopped. And I'm glad for whatever God instilled in me, and with the training and the gifts and talents that I have. All my clients that I have seen have been with me 20 sessions and above. I have two new ones. So I had my first session last week and the one with our third session. But I'm pretty sure, just like the rest of my clients, they will continue to go on with me. And then by me able to talk to them, I'm restoring their hope back into the medical system. Even though there is corruption, even though there is inequality that face, I am helping them build that hope, that belief that yes, just because there's bad apples, there can also be some good ones. And we're planting that seed. And not only are we planting it, we're also nourishing it at the same time, because there's going to come a point in time where we're going to have to terminate, even though we're more long-term therapy, and they're going to have to be able to fall back on these things, and to realize that I can find another Lamar, I can find another Nadina, I can find another Antoine in these other fields for people that care. Yes, Miss Nadina.
I just want to say that I really appreciate all of this the information to substantiate, people when they feel a particular way. Lamar, you are doing a fantastic job in delivering I believe, the necessary information, and it's just true and genuine. So I just wanted to just add that because everything, and I don't know if you see me shaking my head and doing my thing with my fingers or what have you, but it's just a wonderful feeling to be able to receive this kind of information in a professional mental health, how do you say, process, because
Yeah.
that's what it is. It's all about
Yeah.
processing. And
Yes.
I just see the clarity in everything that you're saying right now and how to process. And I also feel like I'm in a transformation zone of my own. And you're just really giving some really good information for me and for all of the clients. And hey, I just can't commend you enough. That's all. Thank you. Thank you very
Thank
much.
you, everybody in the chat. I really appreciate that. Y'all may or may not know, because I know we briefly, but Miss Nadina, she is one of the people spearheading this program. And she brought this to me. And when she mentioned it, I didn't even think twice. I said, I'll do it free, don't matter, does not matter, because this is hard work. And Miss Nadina, thank you for sharing the words, because I'm nervous, because I'm still learning, I'm still growing with the community. But I just wanted to make sure that I'm really doing everybody a justice
Right.
that can't be here, because all my clients are not here to be available. And I'm just trying to make sure that I put their stories to the forefront and highlight that, because I'm not, even though, yes, I get paid and stuff, California is expensive, so you got to make your money. I really do this for hard work. So there's times where I'm speaking to my clients for an hour and 30 minutes.
Well,
And I
you
always tell my client, what's on your mind? What's on your heart? Because I don't want to leave you on a cliffhanger, because I want to make sure you're getting what you need out of the session. And my supervisor's like, oh, well, you can get paid for the hour and 30. I don't need it, because I actually like that I do that 20, 30 minutes for free, because it lets me know that I'm not doing this for the money. I'm really doing it because I enjoy it. So that's the reminder. And thank you, Nadina,
sure, and I
Antoine,
can't
and
tell.
Noel.
I can't tell that you're nervous at all because you are just flowing with an abundance of information. And I
Right.
wanted to ask, are you a Toastmaster? Because you have your transition is so smooth, and it's like you're an expert. I mean, I can tell. You just it's wonderful. I'm just that's all. I'm sorry. I just had to say
No,
that because you are just moving. I can't tell you're nervous. So you just go right ahead, sir. I'm
thank
muting now.
you. Yes, I'm just, I'm very spiritual first, so I'm letting God work through me, and then I'm just leaning on my gifts and talents, and that we're gonna get through this. I felt everybody when Noah and Antoine grounded everybody. I just felt that everybody is coming in a loving spirit, and that is the thing that I help my clients, because what you occupy, what you think about, you're gonna magnify that, and what you magnify, you're gonna magnetize that, bring that forth. So I came in with, I think everybody's coming in here in love. And even if I make a mistake, that's okay, because that makes me human. That's make me connect more to people. And yes, I got my skills, my talents. I went through my education. I've been perfecting my craft, but that's what I always channel. And I feel that is what's being channeled to y'all as well, that everybody's here in love and we're all uplifting each other. And I'm just using one of my gifts, which is the gift of speaking in words, to communicate that. So yeah.
Hey, Lamar, I had a question.
Yes.
So I remember earlier on you had spoke about situations where uh, people get to a space of anxiety and they
Right.
forget to breathe because of a situation that they can't manage uh, emotionally or mentally at that moment. And then we also talk about um, doing the work when you mentioned people doing deep work and just sometimes needing space for a sounding board that they can talk. We've had some folks in our past APs come on and really talk about some really deep introspective thoughts for people to take on. Is there any simple practices that you might have been thinking about giving us or providing us that we can potentially do just to help us in certain moments of reflection or a anxiety or moments where we just want to just yeah, a I because personally for me, I have a couple friends that practice affirmations in the morning,
Yeah. Yeah.
So I'm just curious to know, like, simple techniques that you can provide the collective that we could potentially use as a general space for calm collectivity and like,
You kind of broke up, Antoine, but just to answer that, I do have a resource slide that I'm going to touch into for more practical things for sickle cell warriors and everybody, because you can use this. So I'm going to hold on to that, Antoine, and then I'm going to get to that slide soon.
awesome.
But thank you
Thanks,
for
sir.
that, because that is very good. Because yes, y'all, even though our focus is mental health and sickle cell warriors, we can all take this. We can all add this into our practice for ourselves, the people around us, and the people that we have to serve. Thank you, Antoine. That's a good question. And yes, I have a slide coming up on that, and then we can all discuss that, and then we might try one out or so if we have the time. Therapists, so third bulletin point, therapists can be an important ally by helping warriors process the trauma of these encounters, rebuild trust, and develop strategies to advocate for themselves in healthcare settings. So I actually have a client, and our client, he was saying that in the medical system, they wasn't really treating him well. And they actually, for most Black people, they actually get more behavioral diagnosis and other mental severe like schizophrenia and things like that, even though that may not be the correct diagnosis. Because then, and I'll touch on that a little bit more, so I'm not going to speak on it now, but I just wanted to throw that out there for now, that that is something to be mindful, that Black men and Black clients and people of color, we tend to get more behavioral things because we're not always being perceived as a human being. We're being perceived as this person is being combative or this person that's not complying, and that's just not it. Especially when we're talking about sickle cell, where this is like my 10th person telling you, this is what I need. This is the type of medical treatment I experience. I mean, that I usually get, and this is how it should go. And then you're still not being respected. You're still not being heard. You're still being overlooked. Your wait times is 2 to 3 hours while you're in excruciating pain. So I'll get a little bit more into that in the future slides. So why does Black mental health therapists matter, especially for Black men and people of color in general? When clients work with a therapist who shares their racial background, it often builds a foundation of trust and comfort that speeds up the therapeutic process. This is what is called race concordant care. I cannot tell you how many times my client has, they just from the joy on the phone figuring out, are you Black? Or there might just be certain words that we use, and it's just that cultural thing. And then they'll already know, I'll already know. And then from there, it just speeds up. I even had a few clients tell me, you know what? I'm so glad that I can talk about these things and I don't have to waste my time in therapy explaining what it means. I'm like, yeah, I'm already there with you. I understand. And even though I don't never like to assume, because that's a bias that sometimes we as therapists, Black therapists, therapists of color, we don't want to assume because we share the same skin tone or we say share the same cultural norms that we know everything about our client, because you don't. So you still have to go in with a blank slate. So I have to meet the client where it is. So then when there's certain words being shared, then yes, we can bond and connect on that, because that's going to make us feel safer, because starting off as strangers, that's building rapport. But then I still have to listen to my client, because just because they say they from Pomona or LA like I am, I can't just think I know everything about that client because I don't know their background. I don't know their story. I don't know what environment they grew up and what that was like for them. So I have to also make sure that I'm being mindful of that, to not think just because we share the same skin color or similar experiences, people of color, that I think I know it all. Second, for Black clients, especially men, a Black therapist may already have insight into the unspoken realities of racism, related stress, microaggression, and cultural expectations. Black men face elevated risk, like suicide being the third leading cause of death for African American males, ages 15 through 24. Let that think in. Let that sink in.
Hey,
Your
Lamar, what
yes.
is what is microaggression?
So microaggression is when microaggression is when somebody's doing something subtle. So then so say if I go up to the medical center and I'm like, hey, I'm having a pain crisis and I need to see somebody right now. Sir, I need you to calm down. You're coming off a little bit aggressive. Can we just tone it down? That is a microaggression, because it's not that I'm angry at you. It's not that I'm being violent with you. I'm being combative. It's that I'm just in pain. And right
Mm,
now, I just need some help.
right.
Or the microaggression was when they took my client and put him into the space with dying cancer clients. That's a microaggression because instead of you treating me with some respect and dignity and putting me into a room where I should be placed with just everybody else, you don't know what to do with me and you think I'm black. So my life don't really have that much weight or value to you. So you just gonna put me to other clients. So and that can be indirectly or directly.
Got it. Okay,
Those are
cool.
microaggressions, things that those subtle things, like those things that we go back to our families or that we go back to our groups of people and we talk about.
Gotcha. Okay.
Thank you for asking that because I know other people may not know that. And y'all, please stop me just like Antoine, Miss Medina, my sister, just like everybody else. Please stop me at any time, chime in. I want this to be interactive. I want this to be engaging. But I want y'all to think about that, males between the ages of 15 and 24. If I took child development classes, your brain do not fully develop till you're 25. When you're wondering why teenagers, when you're telling them things and it just seems like they not thinking, like, oh my God, do they ever think this through? Why would you do that? Why would you say that? Why would you engage? That's because that part of the brain that helps them really reason it has not fully developed. And that's not making excuses for them, but it is scientifically has been proven, scholarly proven, that the brain does not develop till it's 25. So then if you're thinking about this statistic, just to add more clarity and context to it, we already have our black men and our men of color already thinking about suicide. They're already thinking about taking their lives before they even know who they're meant to become, before they even give their chance the full opportunity. Because a lot of people say, oh, we got to catch them when they're in high school. We got to catch them in college. No, you got to catch them at 5 and 6 because that seed has already been planted that they don't matter. Nobody cares. Nobody sees me. Nobody hear me. Nobody knows what to do with me, so they stay away from me. They try to avoid having these deep, hard, uncomfortable conversations with me. So that seed of suicide and all that has already been planted. And from 5 to 15 to 24, they've been already nourishing that. And you can plant and nourish bad seeds and weeds that can ruin your whole garden. So the same way we can plant good seeds and it can grow plants and tomatoes and avocados and all these good things, we can have weeds and other things that are not good for our garden that can ruin your whole garden. And that's how I really want us to see when we're talking about this, that this is just not, and yes, this is an actual statistics, and I have all the references, that this is not just something in theory that we're talking about. These are people actual livelihood and lives that we're talking about, that from 15 to 24, it is the third leading cause for African American males to take their lives and men of color.
Hey, Lamar, I had a question for you.
Yes,
My apologies.
yes,
I have a good network of friends, close people to me in the Latino community, and I've
yes,
noticed that they go through some really similar effects in
yes.
respect to their traumas, but obviously different culturally. Do they get lumped into that statistically with African American males, or just specifically African American males, and then there's a statistic separately for our Latino
So,
community
yes,
brothers?
Antoine, great question. And the truth is both what you said. So, with the Black statistics, it also lumps in all men of color. You'll rarely see them doing other things like that. And that is an inequality and a systemic issue. Even though there is other statistics that does do that, but then it's also true that it is also focusing on Black men as well. So, both truths are existing because even when I used to go into meetings where we're talking about equity and diversity, DEI meetings and things like that, they're always they will talk about Black issues and then brush that over with everybody. But just
Gotcha.
how I used to have to educate people, and some of my colleagues that I went to school with is here as well. And they can tell you I used to be in those sessions and be like, you can have two Black people that grew up in Compton, but they can have two different experiences and need two different type of care and support. One probably grew up with a family, but their parents just was low class, blue collar workers. And then another one could have had a mom and dad on drugs and was in foster care, And that is two different experiences, two type for needs. So then expanding that on what you just asked, when we start talking about our Latinx brothers and sisters, our Pacific Islander brothers and sisters, our Asian brothers and sisters, and other people of color, they lump that all in because it goes back to that systemic issue that, oh, if we can just appease the blacks, then everybody else should be okay. Going back to that, what is their value and how much is this worth to them to even invest to look into these things? When I was doing my research for my master's program, when I was writing my dissertation, I had to search high and low to find numbers about blacks and other people of color with transfers rates at the community college and things they face like stress and anxiety. So yes, that is an ugly truth that exists, that they lump it all in together. And then but also what it is focused, because then you get more black professionals who are getting into research like I want to do this, and then it all gets lumped in, and then it doesn't really tell a clear full picture of everybody's story and everybody's background. So yes, Antoine, thank you. Dr. Felicia Hunt, thank you for being with us today.
Hi, Lamar. Thank you. Yeah, so I just wanted to expound on what you're talking about. Wonderful job. So, with the statistics, it all depends on who is doing the study. You will see that some of the data get lumped together, but most often you will always see that sorry, I'm getting a call. Sorry about that. You will always see that African Americans is always at the bottom of the totem pole, then the Latinos, and then other ethnicity groups above that. But mainly, you would always see us categorized as the bottom most
Yeah.
often with most statistics. They don't usually try to lump us all together because of this ideal of individualization. So, everybody is an individual. So then they like to do their own study. So you will see numbers that'll be a little bit higher for the Latinos and a little bit decline for the African Americans. So overall, we are still treated the worst in every category of whatever the data is most often.
Thank you, Dr. Felicia Hunt, for chiming that in. And yes, it's getting better with doing the data and stuff like that. But like Dr. Felicia Hunt shared, we are still at the bottom of the totem pole. And then when it is really talking about mental health and things, we're usually attached to the extreme cases, suicide and things like that. So we rarely get the other side of good things. So that's why things like Black boy joy and Black girl joy becomes a thing, because we're
Yeah.
trying to balance out those narratives that we're not only just struggling, we also can have that other side at the same time that my sister was sharing. We're also thriving in spaces too. So yeah, it's a lot of nuance and it's very complex. But thank you, Dr. Felicia Hunt, for sharing that, because I wasn't thinking to share that.
Yeah, and the other thing about the suicidal rate, like you said, it starts. You can't imagine. It starts even from 0 to
Yeah,
5 years old. So you be like, what could be happening to a baby?
right.
To want to take its life. But I've read articles where babies have used their cribs to choke themselves, and they have used, like, if you got these certain types of blind that's next to the crib, they have used the blinds to hang themselves. So it starts off very, very early. So you just have to know how to watch out for those things, even when the child is not talking.
Wow,
You
I
know,
didn't know that.
yeah,
Thank you for sharing that. And I really don't know that, but I totally agree, because you got to think you're marinating in the environment you're already in. So,
correct. Correct. So
wow.
you be coming through, you are sometimes you're already coming in. You are already born into trauma,
Mm,
And so when you're coming in at birth, you're not aware of what that child been through in that mother's womb. And
right.
that's why when we choose to have babies, we have to be mentally, spiritually, physically, all
Mm,
of that available to have a child, because if you're not, you don't know what kind of damage you're doing to your child when you're just carrying the child, right? And so we don't realize that until the child is out of the womb, and then we could begin to see some of the behaviors. But if you're
Right.
not aware or conscious or anything, you don't know. You don't know what you're looking at. You don't know what you're seeing,
Right.
and sometimes, that's why so many parents have guilt and shame, just like me. My
Mm,
son being diagnosed with schizophrenia. You've been talking about that.
yeah.
And you know and black boys usually are diagnosed with that,
Right.
before
Mm,
anything else. They give them that type of diagnosis. But I researched it firsthand by being with my son to understand that this thing they call schizophrenia is more than what they know. They don't
right.
even understand what it is. And so it's a lot, to deal with a person like that. And as a parent, I had to go through my own guilt and shame
Mm,
around it, because it's like, what did I do? What was
right.
I doing in my environment? What did I do when I carried him? What did I do while I was raising him? What did I miss? Like, how did this happen, right?
Right.
So even when I was going to school, just like you, in my psychology courses, back in the day, they did blame the mothers for the children
Yep.
who were diagnosed with schizophrenia. And when I heard that, I just started crying in class. Like, you mean to tell me it's my fault that my son is this way? It was nothing that they could say, when you're reading these documents, and this is the way they used to go about research
Right.
and coming about diagnosis and stuff. And it's like, how could this be possible? How can they say this? Like, so
Right.
how can we change this? So still, I it's been almost, since 2000, almost 20 years since he's been diagnosed,
Right.
that I still been dealing with this, trying to get to the bottom of it and really understand it.
Right.
But the systems have stigmas too.
Hmm.
And there's stigmas out there, just like it's stigma against folks with sickle cell, and because you black, it's stigma against mental health and
Right.
being black,
Right.
So it's stigmas in the system that create systems that's supposed to help you, but they even are not sure,
Right.
believe in their own theories about how to help people. So it's really a mess out there. So you're doing a wonderful job with what you have and telling the people. And it's really a hit and miss. And you just have to be involved, and you just have to um, learn as you grow, type thing, especially dealing with mental health. It's no real prescription, there's no real drug, there's no real therapy that can really say this is it and this is going to get that person right. It doesn't
Right.
exist. It doesn't exist.
Right. Thank you, Dr.
So,
Felicia Hunt, for sharing that because I had an experience with a mom. I'm gonna read this and then share that Black Americans are often overdiagnosed with behavioral or severe mental illness, as Dr. Felicia was sharing, such as conduct disorder, oppositional defiant disorder, schizophrenia, and they are underdiagnosed for mood-related disorders like depression, anxiety, and PTSD. And so, meaning I can be going through having anxiety. I can be having PTSD from my environment because I've seen people getting shot or I've seen people being screamed at or yelled at. And all these things is going on within me, and I need to be treated for that. But then you're only paying attention to the behavior. So now I'm only a
yeah.
diagnosis to you walking. I'm no longer a human being that needs this holistic approach to us. And I had a mom, she had a child that had ADHD, but she just kept saying, like, no, he just she just kept focused on the behavior. But I worked with kids with ADHD and other things in high
Mhm.
school. Like instead of choosing a cooking class, I chose that. I should have been knew I was going to be a social worker then. And then I was like, and I kept telling my supervisor, I said, I'm working closely, and I think there's something deeper there. And it took about 2 months just for the mom to take him to the hospital, just for him to be diagnosed with ADHD, and
Yeah.
he was autism, and she didn't even have that diagnosis because the other psychologist she had, he kept giving him behavioral things,
Right.
missing every on the stage. I hope I said that right. Camille Linton or Camille.
Camille is correct.
How you doing today?
Oh, this is Sheila. I'm just speaking up with for Camille. It seems like she's still on mute. Lamar, you're doing an awesomely excellent job. Thank you.
Thank you. I really appreciate it, y'all. I'm glad everybody's chiming in, showing me love. Please, this does not bother me. So with this, I'm hoping that all of this is really sinking in for everybody. I know we've been getting more into the statistics, so I want to get a little bit more into the practical stuff. So, what are practical solutions for warriors and caregivers? And these are things that I use on my own clients, things that I use for myself. This is getting back to Antoine's question when he asked, "What are some of those things?" And then please try them out. Something's going to work for you, some not. Even if you don't feel something's working out, try it out a few times, and then you got to see if it's making some progress. You can't just do it one time. Some things work instantly, and some things going to have to take some time. It's going to have some cultivation build up. Let me make sure I'm not missing something in the chat before I get to this. Okay. And then I like how Sheila, you shared the post traumatic slave syndrome because that is a big one because a lot of people don't know. Like when we're talking about why don't black people like getting in water, and even when I ask some of my black family members or friends, they don't know why. Or why can't we get black students to read more and stuff like that? Because I work for all black community college program, and it's like because we were literally threatened and killed, raped and beaten and hung and all these things if you did learn how to read and write. So it's definitely also that too about PTSD that has been carried over when we get into epigenetics, things that has been passed in our DNA. That's why sometimes with all of us, whether you're black in the Latinx community, Asian, Pacific Islander, you watch one there, that is epigenetics because the DNA still lives in your blood. Until you learn how to process and heal that, you will continue to go through life being angry, upset, because then you're also carrying those emotions and feelings of your ancestors. And that's why people get into ancestral worship and epigenetics and how to heal that and things like that. But I won't get into that. But yes, just to touch on that because I seen that in a group chat. So practical solution for warriors and caregivers, daily stress relief practices. So one of those that we all may know or may not know is deep breathing exercises to calm the nervous system. As mentioned, sometimes we get so focused and it just becomes sometimes overbearing for us to deal with, or sometimes with our sickle cell warriors, they're really dealing with physical pain and going through something mentally and spiritually that sometimes we forget to breathe. And what I mean is like it don't mean like you're like some people literally about to lose their breath, they hyperventilate and things like that, but then start breathing faster and then you start not taking breaths as consistent as you would as like your heartbeat rate and things like that. So sometimes I have to get my clients to really get grounded and remember to breathe. And then like how Noah started us off, I know everybody was in the beginning, but we did some deep breaths where we breathe in for 5 seconds and then we exhale for 8 because it really, really does calm down your nervous system and it gets the blood moving, flowing in your body where it needs to so it can balance you out because your red blood cells carry oxygen that your body needs to function in any way. That's why with sickle cell, if when you're not getting those red blood cells with the oxygen, like some of my clients, their hips literally give out on them or they got to get hip replacement or new knees or ankles because they're literally not getting enough red blood cells that's carrying the oxygen for their body to perform the way it needs to. So grounding, breathing, deep breathing. I even tell them to go outside because we're now living in a world where home is kind of also function, to actually fluctuate and kind of stabilize things for us. So go walk in nature, go to the beach and put your feet in the sand and listen to the waves as you breathe in and breathe out, because there's a frequency in that helps your brain really mellow out and really calm down so you can get more clear, and that you can kind of minimize the anxiety, the depression, or the things. That is why depression and anxiety is going up. We're consumed in our phone. Our brain is taking in way more. That's why ADHD is becoming a bigger thing now. People can't sit longer than a minute. That's why TikTok and Instagram, it caters to that. It's actually enabling the problem, because we're not doing things, because our body remembers everything. The mind, the body, and spirit, as I teach my clients, your body remembers everything. It's taking it all in. And even though you're not keeping track, so then we're getting all this input, but then where's your output? And by the deep breathing, going into nature, putting your actual feet into grass, into the sand, these are things that I've told my clients to do, because it helps balance your body. It helps balance your chakras. On concrete, we can't even because the at the bottom of the earth, there's this magnetic thing that actually your body needs to connect to. And that is why putting your feet, and you can research it, there's scholarly research, article research about this, where when you put your feet into the grass, it balances your body, and it, by having concrete and things like that, even though we need it in roads and pavement, those things don't help you connect to Mother Earth like the way you need to. So you got to go to the beach, you got to go to the parks, you got to get into your things that are naturally built into the ground, so you get back connected. And the Jamaican culture, they used to talk about this a lot, because then they believed in like spirits and like, demonic things happening. So then they would tell you to go out to the beach, go out to that, and they would really practice those old school ancestral things to really balance you out. Number two would be journaling to process emotion and release mental clutter. I get people where you talk to other people and you might vent, you might even think it through. I'm or all kind of things like that. But I have my days when I wake up, I do daily my daily devotionals. I'll write in my journal, I'll write some affirmations, because sometimes you need to release that energy from getting from your mind into your pen. And when we're really talking about men of color, the number one thing that I see about men is that they literally live in their minds. They live in their minds so much they're building condos in it. And I mean that literally and figuratively. Because when I'm literally sometimes meeting with my clients, they'll be like, I never even shared this with my wife. Oh, I don't even talk to my kids about this. And then I have to bring to their attention, like, well, you have to do some of these things, because you have to then be a role model. You have to demonstrate to them things that they have to start adopting. So then, if you're not able to process your feelings and emotions and you're living in your mind, how can anybody want to support you in the way you need it to be supported? But then how can you ever really help them get out of their mind and connect in the way that they need to and heal from the inside out, if that's not? So then I'll tell my clients that have a hard time speaking, go ahead and journal it. And then if once you feel ready, you can read that out to your family or keep it to yourself, but you need to get it out from here. And we got to get it somewhere physically, somewhere else. Number three, 10 to 15-minute walks. Walking calms everything. Walking helps with your mind. It helps with your high blood sugar. When you're walking out in the sun, you get the vitamin D and things like that. Walking has so many great benefits, and it doesn't take that much. You don't have to be walking fast. You can be doing a stroll, be doing a quicker pace walk. You can speed walk if that's what you are, because you probably, and it's also burning calories as well. So it's physically keeping the body healthy. And this is something you can do long term, because your body does not really need a lot of recovery time from walking at all. You can walk every day, instead of, if you're running in cardio, you got to probably have to take some time, because then you'll probably feel some discomfort in your knees and things like that, because running and things like that, more high intensity cardio does need higher recovery periods. But walking, you don't really need that. Number two, number Imposter said number four, sorry. Stretching or life movement to release tension. Sometimes we get too comfortable in spaces where we're sitting down, we're on the couch, we're on our phones, we're watching TV, Netflix, Hulu, or whatever. Sometimes we sit in one space too long, and your body is not meant for that. I literally make it a requirement anywhere I work. My bosses have to be okay with me moving. I'm not sitting down all day. If that's a problem, then this is not the job for me, because how can I be expected to perform to my full capacity in 8 hours if I can't move? if I can't reset myself. And then think about it for our sickle cell warriors. There's times when they have to be in the hospital for a week or two. They have to be on bed rest because they don't have the energy. They don't have the blood count, the blood cells that they need to actually do this. So they actually have to sit in bed. So then I have to teach them that you can do little things. So something I'll get into a little bit in the second one is that there's other things to kind of get that. That's what acupuncture is so important about. When you got back pain and stuff and they do acupuncture, they're puncturing in your body to get the red blood cells moving, because that gets the red blood cells moving, then they get the energy moving, because the red blood cell carries a lot of important things that your body needs. So number two, mind body healing techniques. Emotional freedom technique is known as tapping for anxiety and stress reduction. So I actually done this. So when you are stressed out, you'll tap your forehead. Anybody on there, you can join on with me if you want to do it, because we've been here for a while, so you don't fall asleep or anything like that. So you can tap your forehead.
Lamar, let me say this. This is
Yes,
perfect timing because normally we do take a break in
yes.
the presentation where we stand up and we do some exercises because we know people have been sitting. We move around and it gives people an opportunity to just move their limbs or go to the bathroom or do whatever it is. So this is perfect. This is wonderful. Thank you so much.
You're welcome. So yes, like Miss Nadina shared, since we're here and this was divinely broad, let's go ahead and just engage in the tapping. So I want everybody to get into a comfortable space, wherever you are, room, couch, living room. Let's get still. You can do it standing up or sitting down. Let's take in a deep breath for 3 and then exhale for 5. So count in 3, breathe out. Let's do it one more time for 3. Breathe in, breathe out. With that, I want to start with our head. So let's start a little rub, a gentle rub. Please don't do this too. You don't have to be rough. It's supposed to be gentle. And as we do a gentle rub, then let's tap. Tap around your head. Tap around your face. And you might not think this is working because it's very subtle, but it is getting your energy to move. Once again, like acupuncture, the reason why they puncture and I used to wonder too why I got haircuts from my barber. I was like, why do my face look like it got so much life to it? And I was like, duh, he's cut it into your skin. So the red blood cells is bringing in that vitality. Let's move over to our cheeks, just tapping it. Let's take one arm, stretch it out, tap it, go back down. Let's do the other arm, just tapping. It's hard to show y'all in this camera, but I'm just doing simple tapping. Take it down, back the arm. Now focus on anywhere that feels like some pressure. For you, my back, because I've been sitting in this chair. So I'm gonna start tapping my back because my nervous system needs some attention. I'm sitting and I'm tapping there with a nice little tapping rub, letting it know that I need them blood cells to come through and calm me out. I'm gonna do my shoulder, simple tap. And you can mix this. You can mix the tap, the tapping house, and then I'll get into some stretching. Let's do it for 20 more seconds. You can also do your ears and your throat because we've been using our throat chakra a lot, speaking and engaging, especially me. And just touch everywhere. You can do it on your forehead because you might be feeling a little worked up there. So with that, I just wanted to take out a little time because we are closing in on time too. We got about 20 more minutes and I want to leave a Q&A. So I'm going to kind of move through this a little bit fast. But tapping is one thing that I use because you might be like, well, Lamar, what if my client who's a sickle cell warrior can't move? They might be able to do just this. And anything is better than nothing. So I always like to use the tapping mechanism. And then sometimes, it can be kind of sometimes it's kind of embarrassing to work out. Some people, not me or maybe some of us on here, but some people don't like other people watching them as they're trying to engage in these things because they like to feel safe. And I to get yourself so words are being bed rest, they can do that in the bed while also doing that, and then also try to get that energy moving. Number two, grounding meditation or mindfulness to manage pain flare-ups. So sometimes when the pain is coming up, we need to breathe in, get that oxygen, get that flow moving so it can kind of fluctuate things. It don't mean it's the have all be all, definitely when one of our sickle cell warriors is in a pain crisis, but it can help or be a prevention method that we can kind of use to kind of minimize it as much. And then number four, meditations to build resistance with that. But I always say affirmations because what I hear some people say is, oh, okay, you need to tell your mind something different, as if you can forget something and put it with something else that's not reality and that's not science. That would be amnesia. That would be having Alzheimer's and things like that. If you cannot remember something and things like that, that can be an underlying medical condition. So you can't forget all the things that you already believe about yourself that may be negative, not as of high value and things like that. So then you have to override it with something new. And that is where affirmations come in powerful, because we're affirming something new that I'm going to put in my mind. I am worthy of love. I am abundance. I am joy. I am love. I'm affirming these things. All good things are happening to me, even when I'm resting. These are things that we have to affirm to ourselves, that we have to claim, and that we have to override and build a habit, because then maybe you didn't start doing this till you're 25. So you're trying to undo 25 years of how you already been feeling about yourself. And then from there, you've been feeding it with experiences. People do something, see, I told you, and you've been continuing to tell yourself narrative. And it don't mean it ain't some truth in that, but it also means you have had your participation feeding your mind that. So you got to take back your mind by doing those verbal or written affirmations to help build that self-resilience, self-worth, self-value, and things like that. Holistic and physical health support, physical therapy for pain management and mobility support. Um, Very big on that, because there's just some things in science that when it comes to the underlying body that I might not just know. So I'm always telling my sickle cell warriors, have you been to physical therapy? Because it's important. Is yoga something you're interested in? Getting connected and getting one with your body and keeping it flexible, because some of us don't even realize when we sit for hours, the hips be a little bit stiff. Like if you actually go do an stretch exercise, you'll realize how much you needed it. But because you have gone through that, you don't even feel it no more. So it becomes like every day. Number two, exploring safe herbal remedies. I know the medical field and its medicine really does help with our sickle cell clients, but I know sometimes medicine is always the thing we push for. We're always, even when people get a little headache, give me a Tylenol, give me an app. For me, with my symptoms, I'd be like, I got different teas. What tea do you need? I got tea for when you got a throat. I got tea for when you need to relax. I got tea. And tea is a gradual thing that you have to do consistently. Medicine, that's why it has so many side effects, because it's man-made, where it has all these things in it to get it working faster for you. So that's why it has so many side effects, because it chemically imbalances your body. Tea, things that are natural of the earth, and herbs, these things are a gradual buildup. So if you really
Mm. I'm
mantra is
sorry,
small
Lamar.
progress is still progress. Yes, Miss
Lamar,
Ladina.
you sort of broke up for me. My internet is unstable. So could you just repeat that last sentence? I didn't get that.
Yes, so with teas, and things like that, I share that with medical prescription and things like those things are highly enhanced, so that's why they cause so many side effects. But teas is a gradual thing that helps you improve your body. And the mantra that I always tell my sickle cell client, my sickle cell warriors, the things is that small progress is still progress. And
Absolutely.
that small progress leads to bigger progress. You don't go to the gym and you ain't never lift 200 pounds. You start with 30, 40 and you work your way up. It's that same thing when it comes to healing our bodies.
Right.
And teas is one of those great things in herbs. You got to do it consistently. You can't do it for a week, 2 weeks, and think you're going to see this progress, because then you got to think you got to flush some things out of your body that you've been putting in for all this time to even let this to even start working. Sometimes it's harder to fix things and then get to the work than already have it started. So give yourself that space and grace to do so. Yes,
And
Vanessa,
just
I see
let
your
me
hand
say
up.
this too. I just want to say that also, I've practiced aromatherapy. So essential
Mm,
oils is very, very key. And if you just take a moment and think about what essential oils really are and how effective they are, and that's simply because those oils have their constituents, and the medical professionals, all that pharmaceutical stuff, some of
yeah.
that came from the plants, the herbs that we're
Mm,
talking about, the oils, and all of that. So that's where it was, and that's where we began with medicine, because that's all they had before they started making all this man-made crap, right?
right.
So I just wanted to add in that essential oils is very key as well. I use them. Those are my go-tos. If I got a headache, I take a little lavender, rub it on the sides. You know what I
Mm,
mean? Breathe. I have diffusers all in place in my home. I actually encourage people to get them and utilize them for that aromatic blessing that you can receive, because it is powerful when you just inhale it, some of those oils. And if anybody's interested, they can reach out to me, and I can let them know about my background, and anything that I can impart to them with regards to that particular area.
thank you, Miss Nadina. And that's something that I need to get into, Miss Nadina, because even though I know that, I just never thought about it till you brought it to my attention. So thank you, because we know things, but sometimes people need to bring it from a different perspective. And I definitely need to get into my aroma game, because I don't have no diffusers, but Miss Nadina, you have planted that seed, and I'm gonna go ahead and start watering it. Thank you. And then we have Vanessa.
Okay, yeah, I'm sorry. I just wanted to chime in really quick. First, I want to say everything that Lamar has been saying for the last past 2 hours, is he practiced this on a daily, and just recently, Lamar does not like he'll take an Advil or something, but Lamar does not believe in medication for solutions. And I would tell him, "Hey, Lamar, do you have an Advil?" And every time I ask him for one, he'll be like, "Girl, what do you need an Advil for?" I'd be like, "Lamar, I have a headache." He'd be like, okay, but what do like, what do you need an Advil for? And so, like a couple of weeks ago, I had a constant like headache, migraine, and I was taking Advils. And I remember Lamar telling me like, stop always, treating your headache with Advil. There might be something underlying, not something, that might be super extreme, but it could be something like stress or something, something that you've been feeling. And had a situation that I was going through with my kid's father, with court orders and all of that. And I found myself very tense and very stressed for that last past week. And I could not shake this migraine. I was taking Advils the whole day. Like if they say, oh, every 6 hours, I have my timer set for the next 6 hours. And so what Lamar had told me, it had popped in my mind. And I said, you know what? Let me take a day out, even though I was very stressed out that whole week, going back and forth to court, driving back and forth. I was like, let me take out at least a little time out of every day and just be still and just sit there and just breathe, and just, and just kind of woosah a little bit. And as I did that, I realized my headache started going away. And it wasn't to give a discredit to the Advil. It was more so my body telling me, okay, it's something else. There's an underlining to this. And I
Right.
had to really get my body and my mind still for a minute because I was so worked up that even the medicine wasn't working. It wasn't doing what it
Right.
usually did. And
Right.
so after that, I was like, oh my gosh. And I kid you guys not, within the next day, I'm like, oh my God, I don't have the migraine no more. I mean, sorry, within that next week, I didn't have, because I had a migraine that whole week and was taking
Right.
Advil. And so, yeah, and I was just like, you know what? I'm gonna take what Lamar told me, and every day, like for 30 minutes, because I am a mom, so I don't really got time to sit down. I was like, I'm gonna give myself at least 30 minutes to just be still and just breathe. And I kid you not, slowly but surely that headache, that migraine, it went away. And I was just like, wow, it's not just medicine, it's not always the solution. Sometimes
Right.
you really need to still yourself and relax and breathe. Like breathing is very fundamental. We take it as we normalize it so much, but we don't realize that, okay, you're breathing, but are you actually breathing? You
Right.
know what I'm saying? So yeah, I just wanted to second that Lamar, everything he's saying, he really does practice this and teach and still in his friends and our in his family daily. And besides the research is actually factual, like it actually works. So I appreciate that, Lamar, because I put something you taught me in practice and it really did work. So thank you.
Thank you for sharing, and thank you everybody in the group chat that is sharing, that is also sharing other resources about. Number three is in spiritual practice, prayer, music, or rituals. I don't think I will go too much into details like that, but you got to make sure you're spiritually aligned and in tune with yourself and with the world around you. Because sometimes we be so mentally out of, I mean, so spiritually out of whack that is also throwing you off. So then when you go and run into that medicine, when you running into those external things, it's some things that the soul needs some tending to or some surgery on, and you got to really be clear about that as well. And then lastly, community and identity affirming support. So join support groups or warrior communities to reduce isolation. Isolation does lead to depression, anxiety, and overthinking and over analyzing and things like that. It's not nothing wrong to be observing and things like that. But when we're overthinking and over judging, we then become paralyzed and analyzed where we can't even move and do and make the changes and do the things that we need to do. So let's be mindful about that. I'm gonna kind of speed through these. Seeking culturally affirming therapists who understand Black male experiences. Sometimes you need a therapist that get it, and it doesn't mean somebody of non-color can't relate to your experience, but you have to do that. If it does not feel right in your spirit, it does not sit right with you, the therapist that you're working with, it's okay to shift. Sometimes clients don't think they can pick another client even though they're paying or their medical insurance is covering it. You have the full autonomy to choose who's working for you and if this is right or not. And just how you got to go try on different sizes at the mall, clothing and shoes and things like that, you got to do the same thing with therapists. And then you just got to be real. Is it with your therapist and you just need to connect with the right one? Or is it that I'm just fully not ready for this and I'm halfway committed and maybe I need to take a pause and then come back to it when I'm ready? So it can be either one of those or both truths. And number three, involve trusted family and friends as emotional and practical support. Put those people that you need around you because sometimes you're not only going through a physical battle and a mental battle, you're going through a spiritual and all three at the same time. So please make sure that you're checking in, you're building community of support and people that really, I like to say your village because in Africa and other places like that, they call it a village because in a village, it serves a purpose that it is everybody's business and everybody's priority to take care of each other. So not only let's be in community, because we're in community like this, but when I say people are part of my village, it is my job to make sure I'm checking in on you. That I'm making sure you're okay. And it's your job to do the same for me and everybody else that's in our village. So let's make sure we're building a village of intentionality, people that we can all to depend on, but we can also depend on where it's this even exchange of things that we're giving. And it doesn't mean you got to expect people to do exactly the things you do because you do the things you do the way you do them and they're going to do it the way they doing it, but it means it needs to be given some back. So if I'm uplifting you in the way that I do it, I want you to uplift me in the way that you do it. And some for me, that's giving words, that's talking into your spirit, information and knowledge and things like that. For other people, that can be gifting, giving people gifts. Or I'm gonna gift you a journal so you can write in and things like that. So it doesn't have to be the same, but it does mean it has to be even, meaning we're both pouring in something to this cup of we call the village where we're all benefiting from it. So with that, and then yes, I'm going to the next slide. Also, because I got a little sidetracked there, Noah put a survey in there. So as I'm finishing it up, if everybody can please fill out that survey. It is just a survey that's kind of talking about how I'm doing with this workshop. Did you find it engaging, informative, and things like that, and potentially do something else in the future? So practical strategies for providers and programs, because I know we have focused a lot on sickle cell warriors, which the focus still is, but what can people who are the providers or providing these services do? Challenge myths about masculinity and weakness. Educate staff and clients to dispel stereotypes that mental health issues among men of color reflect personal weaknesses. These conditions often arise from trauma, discrimination, and environmental stressors. When growing up, when I spoke about having mental issues or anything like that, therapy was never in the conversation. And when I would go with some of my homies and we would talk about certain things emotionally, trying to open up and being vulnerable, you would get junked on and laughed at. So this is something that we have to then start becoming mindful about, start breaking down these stigmas and start challenging these myths that it has nothing to do with masculinity and weakness. One of the big things that Alec Baldwin said that I really love is that men focus so more on performing gender that they'll never fully really know themselves. He said it in his own words, but to conclude it, we focus so much on masculinity and performing gender as men that we cut ourselves off from a whole different aspect of ourselves that we don't even get to tap into and lean into because we're too busy worrying about how the world is going to perceive us and how that looks to our homeboys. And if you like somebody like me, grew up in LA, Pomona, San Bernardino, where it was just always sometimes gun violence and gang members and things like that, you had to have this certain persona. You had to be tough, and I ain't nobody to be messed with as a man because then that's how you kind of kept trouble away. Or when trouble did come at bay, at least you were willing to go down so nobody else would try you. So those are some of the things that I mean from the trauma, discrimination with cops and things like that. Number two, improve detection of non-traditional symptoms. Train staff to recognize indirect emotional expressions like changes in demeanor, substance use, isolation, especially in men of color. If you see somebody behavior changing where somebody's always happy, they're engaged, or just the way they always show up and you see something change, do a quick check-in. It don't take nothing a minute or two. Be like, hey, are you good? I can't tell you how many of my sickle cell warriors or my boys in the community college for the Black program that I worked for, how many times just asking them, I always start with, hey, how you doing? And then they'll give me the, I'm okay. Oh, but they know now after about the eighth session, I'm not asking you how you doing because I want it surface level. I'm asking you how you doing because I really want to know what's going on. And then I always started with, we're starting the session off, tell me what's on your heart and what's on your mind. Every client, you can ask any client that I've had, what is on your heart, is on your mind, because I want you to tell me the things that are deeply affecting you. Not those, oh, I'm good, oh, I'm okay. What's on your heart, on your mind? What is it that you need to share in this space that you may not always feel? And my clients always tell me, I don't even tell other people, my family, my friends, my wife, my husband, whatever, these things. What's on your heart? What's on your mind? I'm giving them that space to do so. Implementing culturally informed diagnostic tools. Use assessment methods that respects clients' cultural backgrounds and contexts, like biopsychosocial interviews and cultural formulation interviews to reduce overdiagnosing of severe disorders and underdiagnosing of mood disorders. We already kind of talked about that. And that's why I'm very big on assessments, because you really are assessing and really figure out more about your client. It doesn't have to be that long. It can be 10 to 15 minutes. I do our mental health intake, so it's not a full assessment, but we agreed in the CARE program to do the intake for our clients that is coming into they're already in the program, but move on to the next step because we want to do that quick assessment. Where are you at mentally? Do you even have the capacity to move through this program the way that we think you need to move through it? And then if not, how can we prepare you before we throw you in? Because it's what good is giving the client quantity programs, all these people of service, but then the quality, they're not utilizing it. It's not really beneficial. It's not being effective as it can. I'm more quality than quantity. Quantity is needed, but I want to know the quality. I'd rather you meet with a life coach, a therapist, and then like Noah Education Leon, and you use that till it's full of potential, then you meeting with 10 people and none of it is sticky. So that is where these things, we're having to culturally inform assessments and things like that come in. Build bias awareness through testing. Encourage clinicians to assess implicit bias. And they have a test, which is the implicit association test. It's free. You can do that. And remember, I had some of my bias because then I'll be like, why are they coming if they don't really want to work on nothing? But then I had to realize one of my bias was they are working through something. Some people don't even have a safe space to vent. I had to tell one of my clients, his girlfriend take up so much of the emotional space that's why you emotionally spaz out the way you do, because you're not creating no space for you, and she don't help you create that space either. So then I told him, I need you to write a letter, because he said he felt comfortable doing that. And that needs to be your priority, that you need the emotional space to have your emotional needs met as well. And it stunned him because he had to take the accountability. He created the dynamic and fed into that, enabled that, where it was always about her emotional needs and very about his. So not only do she have to take accountability, you also played into that and you was a participant. So you got to go back and do that work. And then with that, um, integrated peer-led interventions, promote healing circles, narrative therapy groups. I like doing narrative therapy because I focus on patterns, as I shared in the beginning, because I focus on the pathology, things that you've learned in your environment, things you observed in your household. I focus on the pathology, the pattern that's been passed on you, because then I can get to the behaviors and the reason why you act and think the way you do. And then I can get back into the things that happened in childhood. And then what is those narratives that have been going on? What do you tell yourself? How do you feed into those narratives? Are they positive or negative? What has been the consequences and the outcomes of these narratives that you've been playing out? So narrative therapy in groups is really helpful, because then it gives everybody the chance in a group to understand everybody more, and then we feel more connected. And storytelling sessions that validate clients' experiences and build community, like we did today, like Dr. Felicia Hunt, my sister, Miss Nadina, Noah sharing in the beginning about his experience with sickle cell as a sickle cell warrior. These are all things by sharing our experiences that made us feel more connected, and that really, besides me explaining, help shift this and make this more, drive it home even more, because you guys are engaging with me. Leverage family and social support networks. Encourage family involvement and peer support to provide emotional comfort, practice daily support, and improve treatment adherence. When you feel others are doing it, you are even more encouraged to do it. So what if we can get the families to start doing these breathing exercises? What if the family say, hey, after we eat, let's walk for 15 minutes. Then when we come in, let's do a breathing stretching exercise before we all shower and go back to our corners to go ready to go to bed. I even do it sometimes where my nephews will literally be mimicking my sister, who shared about her being a mom, and she'll come in sometimes and they'll be trying to do the exercise with me, push-ups, yoga. Oh, what is this for? Why are we doing that? And they're only 7 and 8. And they was asking me these questions, asking me why am I doing this, and trying to mimic that, because being a role model really does matter. And they may not fully understand why this is important to move your body, but I'm already introducing them to the ideal that as men, we still have to take care of ourselves as well. And then Noah, I'm gonna go ahead and pass it to you. I see your hand is up.
Yes, sir. I just want to say I hope you all have been enjoying this presentation. We are at our 1 o'clock hour, and I would like to remind you to fill out the survey here at the bottom to let Lamar know, let SCAASF know about your experience. This data is so important to us, so please fill it out. To conclude, we will have some resources to share with you that Lamar has so kindly shared with us, and we will email that out to you. But if it's okay, I can make room for maybe 3 more final questions for Lamar before we have to go, because we want to honor his
Yes.
time. So
Yes, because I
3
do got
final
somewhere to go.
questions,
Mm-hmm.
and then we're going to conclude. I'm seeing in the chat, thank you, Lamar. Thank you, Lamar. This has
I
been
also,
amazing.
not to cut it off, I dropped in the chat the resources. So if anybody want to get that, because I know some of y'all don't have Noah's information to get that email, I'm about to drop that in the chat. So you can click on that and have it. It has the resources like the practices, the things to ground, the deep breathing, but also the references if you want to use this data in something you might be presenting, because all of this is scholarly data or it's organizations that focus on that. So I already dropped that in that. And thank you, everybody in the chat. I see you. Thank you, Zuli. Thank you, Maya. Thank you, everybody in the chat. I really do appreciate it for y'all sitting through this. I know it was pretty long, but you guys are true champions. Thank you, Autumn. That is one of my college peers. Zuli, that's family. Thank you, Dr. Felicia Hunt, for sharing. Thank you, Kesia Johnson. Thank y'all so much. And Nora, I'll pass it to you for any last things or anybody got questions or anything.
No, that's it. Any last questions you may have, and then I want to pass it to Nadina for our closing of this presentation. Lamar, this was wonderful. Thank you for this. You are obviously my favorite person, but anybody who has the opportunity to have you as a therapist or as a coach, they are very lucky because you definitely empower them and empower me to continue to be positive in the midst of living with this disease. So thank you so much.
And
Nadina,
yeah, I just wanted to say, is Camille having a problem?
it looks like she's in a crisis right now,
Mm.
Wow.
but she's in the hospital. Camille,
Okay.
we praying for you, baby.
We're praying for you,
Mm.
sweetheart. I'm so sorry to see you in pain. I just, in closing, want to say that um, I appreciate all of you all joining in on this, and it's just been very rewarding and very informative and very helpful. And I want to also thank Lamar for everything that he's presented today and let you know that I want you to come back next year and present again. Um, Part two of Lamar Jones and the mental health area in the whole world because you are just a wealth of information, sir. And once again, all of you, thank you so much. And I really appreciate it. SCAA really appreciates it, and we look forward to, if you are in the Bay Area, coming to our walk on our expo on 9/13, and if not, well, look for video and all those highlights on our website. And you all have a safe rest of your day. Thank you.
Thank you, Miss Nadina. Thank you, Noah. I'm so glad to have met y'all that our paths crossed. Thank you, Valerie. Miss you. I'm just thankful to do this and honored to work for this community. Noah, you are a superstar in your own light, y'all. He was just one of my clients, but then we had to terminate so we can work together because he really wanted to bring me onto the team. And y'all, he's amazing. And he doesn't let, even though he's physically dealing with something, he lets there be no ceiling in his life, and he is a true champion. And Miss Nadina, thank you for bringing me on and always being just authentic and open and honest and doing this work. And I know it's tiring, and I know a lot of people don't see the background work that you, Antoine, and Noy that y'all do. But thank y'all for creating spaces like this for us to learn and grow and be in community.
And thank you, Noah. I am so sorry. I forgot to thank you specifically, sir. You did a great job today as the moderator, and we look forward to you doing more or having assisting with the AEP. So you are a gem. Thank you.
Thank you, everyone. Thank you. Have a good
Thank
day.
you all. Bye bye.